And then following that, we will open up the floor to the Q&A if you do have additional questions that aren't answered in the presentation. For those of you who are calling in, unfortunately, we won't be able to take any questions over the phone, but for those of you joining us on Zoom, you can type your questions into the Q&A feature on your screen. That's the easiest way for us to keep track because we can resolve them as we go through, just to make sure we don't miss anything. And before I pass it over to Jen, I will just quickly read a little disclaimer here just regarding our call tonight. So the call tonight for September 28th, this video discusses matters related to residents of long-term care homes owned and operated by Grey County, and it's during the COVID-19 pandemic. Please feel free to share this video with others in the Grey County community. If you have a family member in a long-term care home not operated by Grey County, please contact that home if you have any questions or concern about their care. And with that, I will pass it over to you, Jennifer.
Great, thanks, Rob. Good evening, everyone. As we have in the past, I will give an update and I'll just read through that for you, and then we will get to questions. So as Rob said, I'm Jennifer Cornell, supporting the 3 long-term care homes operated by the County of Grey, Grey Gables in Markdale, Lee Manor in Owen Sound, and Rockwood Terrace in Durham. So we last met virtually on September 8th. Since that time, there have been further directive updates from the province, Ministry of Long-Term Care and Public Health. Our infection control, staffing, and PPE strategies continue in the homes. As of today, there continues to be no positive cases of COVID-19 in any of the 3 homes. Lee Manor is in a confirmed respiratory outbreak. All swabs have been taken, were tested for COVID-19, and those results so far are negative, and we'll talk about that a little bit more. The purpose of our call tonight is to provide an update on the status of infection control and COVID planning and the pandemic status of what's happening in our home. During this call, I will provide updates on the Lee Manor outbreak, changes to the requirements for short-term and temporary absences, Thanksgiving plans, DCP COVID testing on site, planning for second wave, and then answer any questions. So we are seeing the provincial numbers of cases of COVID rising daily, and today had, I think, a record number of cases for the province of Ontario. In our immediate Grey Bruce region, we are seeing a slight increase in cases with 6 active cases. 1 long-term care home in our region is in a COVID outbreak, and my understanding is that outbreak is related to a staff member and that the outbreak is being managed well in the home. We must keep in mind that there continues to be community spread of the virus, and we must remain vigilant in our strategies to prevent infection. These strategies are our first line of defense in stopping the spread within the home. I'll give a quick overview of the strategies that continue to be in place. Active screening for every person who comes in and out of the building. This includes every team member, every service provider, and every visitor, essential visitors and indoor visitors, and designated care partners. This active screening includes documenting name and contact information, taking temperature, answering specific screening questions, as well as on-the-spot education on donning and doffing mask and PPE, hand hygiene, and respiratory etiquette. Staff continue to work in only 1 facility. Staff interval testing continues every 2 weeks. We minimize the movement of staff from home area to home area within the home. All staff and visitors in the home are wearing surgical masks at all times. All new residents moving into the homes are tested for COVID and are isolated for 14 days and also tested at the end of their 14-day isolation. Plans are in place in all 3 homes to quickly isolate residents or quickly move into full outbreak protocol if needed. And we continue to monitor PPE supply and report our inventory to the province weekly. So the Lee Manor outbreak. There is a respiratory outbreak at Lee Manor on home area 3 South. 10 residents in the home area are symptomatic, and all residents have been tested for COVID and influenza. 8 out of the 10 results have come back negative for COVID-19. We have not yet received the results for the influenza testing, and so it is still being called an unknown virus agent. The team in the home works closely with public health for all outbreak management, not just COVID outbreaks, but any outbreak we've had in the past or may have. The public health team provides guidance and outbreak management leadership. The case definition for this respiratory outbreak is a resident or staff member with 2 or more new symptoms, so not to be confused with allergies, for example. So 2 or more new symptoms of fever, dry cough, or productive cough. The containment strategies in place for this respiratory outbreak include affected residents are isolated to their rooms, including their roommate if they have one, and efforts are made to keep the roommates distanced from each other. Visiting on 3 South has been suspended with the exception of essential visitors for palliative or critically ill residents. Increased cleaning to the area and the home. The doors to 3 South have been closed to assist with containment. Signage is put up throughout the building. Crafters Corner has been converted into a staff room to support cohorting of staff to that home area. And we're cohorting staff where possible. We're increasing staff where we're able to, and we're closely monitoring all residents in all home areas for symptoms. Designated care partners are still permitted to visit residents in other home areas. However, these visits must take place in the resident room only. Changes to the requirements for short-term temporary leaves of absence, and I've seen them written other places as day trips. So on our chart, we call them short-term or leaves. Temporary leaves are the overnight leaves. So we'll talk about the short-term day trips first. So as the COVID-19 cases in Ontario increase and our community is now seeing respiratory outbreaks, we have updated our guidelines for resident outings in our long-term care homes. The province has implemented restrictions which have been initiated across the province in an effort again to flatten the curve. In addition, we have received growing concerns from family members requesting that we apply further measures to protect their loved ones regarding resident absences from the care community. After further review and careful consideration of our changing landscape, we have modified our precautions regarding short-term absences, day trips, or outings with family and friends to include some additional safeguards to prevent exposure to COVID-19 in our facilities. So I'm going to, I think, share my screen. I'm going to try to share my screen. It worked last time. There we go. And for those of you on the call, I apologize, but we will be sending this out tomorrow. So the letter is a summary that I just kind of summarized about the reason for implementing some changes. And then these are the short-term changes, day trip changes. So for now, if you wish to take your loved one out on a day trip or outing, we're asking that you contact the RPN to schedule the outing at least 24 hours in advance. We are implementing some new criteria. So we're asking that all family members or friends that you self-screen for COVID-19 symptoms prior to picking up the resident. And really, this is a good practice that we should all be getting into for any time we're leaving our house. We should do a self-screen, do a check. How are we feeling? Any new symptoms? Is that tickle in our throat? Is it allergies? Are we not sure? And there are some resources on the provincial websites of self-screening tools, and we'll include that in this email also as a resource. So we're asking that you self-screen. If for some reason you feel that that maybe you shouldn't be heading out of your house that day, just give us a call and we'll cancel or reschedule the outing. In addition to asking you to do that self-screening, we are also going to be actively screening the visitor picking up the resident. And so this is new. There will be a declaration and screening form that you will receive when you arrive at the home to pick up your loved one. And we'll go through that in a moment. So the package of information remains the same, the infection prevention measures, and the criteria for the overnight stay is not changing from the last time we talked, but we're including the information that's going out tomorrow just as a refresher. So I'm scrolling through that, This is the new form. So this will be a paper form for now. We're going to see how it works in hard copy before we move it into an electronic version. So you will be arriving to pick up your loved one to go on a day trip, and we'll ask that you complete this, and we have staff available to support the completion of it. So we're going to ask the questions, all of the usual questions you're getting asked when you're out and about your symptoms, if you have any worsening symptoms, and it's a long list. Have you traveled or had close contact with someone who has traveled? Do you have a fever? And we will be taking your temperature. Have you had close contact with anyone with a respiratory illness? And as always, if you answer yes to any of those questions, we will ask you to put on a mask, and we'll give you some instructions on what the next steps are and recommend that you go and have a test. The additional screening questions are that you attest that you will ensure that you will follow the IPAC measures while you and your resident are out on a day trip, that you're going to wear a face covering at all times, that the resident, when possible, will wear a face covering, that you will maintain physical distance of 2 meters from wherever you're going, and that you will wash your hands well and often, and you will ensure good respiratory practices, so coughing etiquette. We're going to ask that you attest to those things. We will have staff available to help with some education, answer questions. Have you reviewed the updated information for the guide? That's this package, so you will be able to say yes. And do you understand the health risks involved when taking a resident out on a leave? We're going to ask you to put some details of your outing. And then this release of responsibility is just taken from the sign out sheet that we always had in place whenever a resident would sign themselves out or a visitor would sign out a resident. It's the exact same language that was on that sign out sheet. We've just combined it into one place so that you don't have to fill it out twice. And then you'll sign your name, and the screener will also put their name. And then the rest of the package, any of you that have been visiting will be really familiar with this package. It's how do you use hand sanitizer, how do you do a good hand wash, coughing and sneezing etiquette, donning and doffing your mask, and some tips and instructions around physical distancing. So I'm going to stop sharing, pull back up my notes. Okay, so in summary, if you're planning to take your loved one out, we ask that you contact the home ahead of time and speak to the home area team nurse to make the arrangements, and we are now asking for 24 hours notice. The visitor picking up the resident will now be required to actively screen and fill out a declaration form. There's a spot on the form to write down the details of the outing, and the education package will also be provided. When you are thinking about having an outing or a day trip with a resident, I would really like you to think about the level of risk associated with the various activities. So for example, outdoor visit to a park with 1 or 2 people from the local community is much less risk than a family dinner indoors or at a restaurant with 10 or more people from a variety of communities across the regions. So if you're not sure about the level of risk to your planned outing, just ask. The registered staff or leadership team members are available to talk through the different options. And I want to stress that I'm very concerned about the level of risk associated with outings and day trips. When considering an outing, see if there is another option on site that might be better or less risky. I understand that other long-term care homes in Grey and Bruce have suspended their outings or short-term absences effective today. So we're going to monitor the situation this week, and we will make a decision about outings by Friday, October 2nd. If anything changes more abruptly, I will let you know via email. And we'll have a minute or two to answer some questions about that as well. So this brings me to Thanksgiving. We are all wondering what the upcoming holidays are going to look like, and even our Prime Minister mentioned this following the throne speech. The teams in the homes have and continue to work hard to help make Thanksgiving and autumn special for the residents. The homes are decorated and plans are underway for Thanksgiving dinner with all the trimmings. I would urge you to consider how to celebrate Thanksgiving with your loved one in a different way this year. Virtually with the Color It Connect program, a window or indoor visit, or with a scheduled visit, rather than going off-site. So designated care partner update. Thank you to everyone who's engaged with the DCP program. Residents have identified their DCPs and many people have worked through the education program and the testing requirements. There are also residents and their families who have opted to wait to implement the DCP program and are continuing their visits virtually or with outdoor visits. We will continue to offer the variety of visiting options in order to best meet the needs of the residents and their families. There are now a large variety of options to connect with your loved one. Virtual, FaceTime visits, window, outdoor, indoor, essential visits, which are more urgent, i.e. palliative or critically ill, and then designated care partner, which is bedside and ongoing. We have heard from many DCPs that getting their COVID swab every 14 days has been a challenge. We are able to announce tonight that testing is now available at Grey Gables for the Grey Gables DCPs. This was communicated last week to the Grey Gables DCP group, and today 23 care partners were tested. This will continue to be available every 14 days, and these tests must be pre-scheduled, and we are working on updating our online booking tool to include the testing dates. Manor will be next to offer testing for their DCPs, so please watch for an email with details for dates and how to pre-schedule your test. And Rockwood Terrace is actively working with their medical director to work out the details to bring this to the DCPs at Rockwood Terrace. Finally, regarding all visits, I am concerned and disappointed to share that not all visitors are following the required protocols. Please know that this is very serious and the expectation is full compliance of the rules. There is just too much at stake for us to not take this seriously. Our staff have been directed to follow up with individual visitors who are not complying with the rules. They will talk with you and they will provide retraining as needed. Thank you very much for your understanding and agreements to these protocols. Wave 2 planning. Our staffing levels remain stable. However, as we mentioned at our last call, a number of our students that worked throughout the summer have headed back to school, and we are actively recruiting in a number of areas across the 3 homes: RN, PSW, FSW, and emergency support workers to support the nursing teams whenever we're shorthanded. Our team members continue to be our #1 asset, and our goal is to be an employer of choice, offering a great work experience. And I can't thank our staff enough for all they've done and continue to do to color it for our residents. Another part of Wave 2 planning, Rockwood Terrace is increasing the electrical capabilities in the auditorium in preparation for an outbreak. It's part of our containment plan, has us relocate any residents who have tested positive for COVID-19 to the auditorium so that we can care for them in a cohort with dedicated staff while still protecting the other residents. And so Rockwood is increasing the electrical outlets in the auditorium to support oxygen concentrators, electric beds, etc. PPE is always on our mind, and we are constantly monitoring and stocking up on our PPE supplies and have been throughout the summer. We are looking that we're in good shape, but we are always watching it. With an increase of people coming and going from the home, our in-house strategies are as important now as they were. Universal masking, hand hygiene, changing of uniforms, active screening of staff and residents and visitors, physical distancing for residents at meals and activities, quickly isolating and testing any staff or residents with symptoms. These are the initiatives that will help us manage if we encounter a COVID case. We must remain vigilant in our efforts. They have got us this far, and I know that we can do this throughout the fall, and so appreciate everyone's participation and patience. So that is my update. I am thinking that there will be a few questions, and so let's get to the questions.
Sure, we do have a few that came in here, and if you have any more, please continue to type them in the Q&A, and we will get to those. The first one comes from Russell, and he was asking this when you were talking about the new screening. In particular, there was a question in there about have you traveled, and he just wondered if you could define traveled.
This might be where I need, these rules change regularly. And so I think at this point, and I'll wait for my phone to light up, but I think at this point, travel is outside of Canada. There may have been some additional about outside of Ontario, and that just prompts us to ask more questions and then be able to do a risk assessment based on that answer. So it doesn't automatically preclude you, but it does give us an opportunity to ask some questions. And outside of Canada and international travel, I was right. So that's what my all the friends have let me know. So thanks for that question.
So for the short-term absences, does this 24-hour notice apply to going for a walk out the front door of a building or down the street? These walks are weather dependent, so to book in advance or cancel once you arrive if weather is not appropriate. To date, we've never had seen anyone on these walks.
I think that we're going to have to be flexible and understanding with each other. So even if you're able to give the home a shout in the morning to say the weather's looking good and I would like to stop by and go for a walk, if you could do that, that would be great. That way, if something has changed, the home has a chance to let you know that there's been a change or there's a concern. Otherwise, it just gives the home a bit of a heads up so that they can make sure the resident's ready to go and meet you at the door and go through the new paperwork.
Thank you. Are there plans to implement throat swabs for testing in the future?
So my understanding is that there's lots of work happening provincially at looking at alternative testing, ways of testing. And so here's where it becomes very clear that I am not a nurse. At this point, we are still doing the nasopharyngeal tests. I do think in special circumstances, we have the opportunity to do a different kind of test. But more broadly, not yet, but that work is happening.
How many staff have been swabbed? As a designated care partner, it's mandatory, but for staff, it is not.
That's true. I'm just trying to recall the numbers. It does ebb and flow, the staff uptake of the testing. The last report that we gave to Committee of Management, I think it was around 40% to just a little over 50% of staff regularly having the test. We have seen it increasing more recently, and so I think staff are doing that. It seems to have increased a little bit more since school has gone back in.
Mm-hmm.
And we do talk a lot about how important it is and try to make it as easy as possible for people to be tested.
Thank you. When you were speaking of the outbreak at Lee Manor, you had said that 8 out of 10 have tested negative for COVID. So there was a question here about what about the other 2? Are you still awaiting results or were they positive?
No, we are still waiting results. Yeah, we would follow the same protocol that we have always done with Outbreak. And if you were from Grey Gables and part of the false positive during the universal testing, you will know that at any sign of whether it's influenza or COVID, we will be sharing that information. If it's COVID, we will go through our notification process in the same way that we did for the respiratory outbreak. We would do that again and make sure that people know. We work with public health closely. They get the results, they share them with us, and we talk about communication with residents and families and staff. is a key part of the response. And it's really important to us that you hear that information from us, if possible, and not through the media or on a website somewhere else. So that is always our goal.
Okay, well, we know that COVID isn't the only thing that is going around. We have a question asking, when do we expect to have the flu vaccine available to residents in our homes?
So I think my phone just lit up about that, so that's good. I know that the teams have actively been talking about the vaccine campaign and starting the process to get ready for that. I don't know if we have a date for the flu vaccine. They have been ordered, but we don't have a date of when we'll be receiving them. But as soon as we get them, we'll be ready to give them out.
Okay, thank you. So staff can't work in 2 long-term care homes, but what about staff working at long-term care and another job, such as at a school or a physio clinic?
So that is still permitted. We have had lots of staff let us know that they do work in another job outside of healthcare. And so that's why our active screening is really important. So we actively screen anyone coming into the home twice a day on their way in and on their way out. And that's another measure to help support kind of getting ahead of potential infection spread by vigilantly checking in with people.
Betty is asking about the outbreak at the Manor. Was that the outbreak on the 3rd floor?
Yes.
You mentioned that Grey Gables designated care partner COVID testing will be scheduled every 14 days. Can we visit our resident on the test day, even though there will be a gap between the last test and receiving results of the current swab test?
That is a great question. I'm going to touch base with the teams and see how they schedule the 2 weeks. I think that we will look to schedule them so that there isn't a gap or the gap is as minimal as possible.
That would be great. I'm sure that that would be really appreciated. If a resident tests positive, will they be moved to the auditorium? I don't quite understand this and would like further explanation, please.
Sure. So as we have gone through the last 6 or 7 months of pandemic response and then pandemic planning, we have had the opportunity to hear other regions in the province and other parts of Canada in how they have planned and responded to outbreaks in their long-term care homes, and have had the opportunity to learn from that and implement some of those actions into our planning. And so a couple of long-term care homes that were really fairly successful in containing the outbreak, they had a COVID outbreak and they were successful in containing it. As soon as they had a positive test, they cohorted residents together that were ill. And so what they did was they created kind of like a field hospital site when they had the ability to do that. And they helped move the resident to the auditorium, for example, at Rockwood Terrace, where they would have dedicated staff. And so they'd get the care that they need. And at the same time, not be on the same home area with residents who have not been in contact with them or are not showing symptoms and so the idea is that it will help protect the residents on the home area and still be a spot to look after the residents who have symptoms or who have tested positive.
All right, thanks for that, Jen. Our next question is around staff travel. Do we have any special requirements for staff returning from vacations? And the comment goes on to state, some staff have flown out of province for weddings, but those staff aren't required to do a test, only screening.
So I'm going to have to double check, but if anyone has been away for longer than 2 weeks, they are required to have a negative code. They are required to be tested prior to returning to work. And we offer that test on site. So we're able to do that test outside of our regular surveillance testing dates.
Okay. Now, if they were traveling out of the country, am I correct that that would require a test and isolation just as part of the guidelines
Yes,
in Canada right now?
that's right.
Are we able to have Thanksgiving dinner with our loved ones?
Well, at this point, I don't know. I don't know is the best that I can say. You probably will not be able to have Thanksgiving dinner on site with your loved one. So even if you're a DCP right now, the protocols require the DCP not to be eating with the residents so that you could support your resident, your loved one, while they eat their Thanksgiving dinner. It's not quite the same. I am really, really worried about family gatherings. I'm worried about residents going out. I know how hard it is to have gone so many months without getting together. So I think that each one of us needs to think really long and hard about how can we mitigate the risks to be able to do something for Thanksgiving. So what can we do in the home to support a celebration that is maybe looks a little bit differently? And or if you really want to go out for Thanksgiving, bring your loved one out, I would suggest we look at smaller group of people, not the big group of family, keeping that tight, those kinds of things. And we still have a little bit of time before Thanksgiving. So I'll touch base with the clinical teams and see if we can come up with some sort of tips and guidelines or things to think about, things to consider when thinking about Thanksgiving, just to help each of us think through what the risk might be and what the implications might be.
Mm-hmm. Okay, we have another question here regarding staff testing. I know that this is a theme that has been coming up quite a lot in these calls. If people do have concerns about the regulations around testing and why staff wouldn't be required, who would they be best to direct those to, Jen? Because I know that we can't really respond to the policy behind it. We just have to follow what's in place.
Right. So the policy comes from Ontario Health, which is a part of the Ministry of Health and Long-Term Care. And we could look at putting some sort of a resource link in our email that goes out. I'll make a note so that we do that. I appreciate the frustration, I do. And so we continuously look at ways that we can support staff in making the decision to be tested and to make it as easy as possible so that they don't have to go kind of make a special trip in, or so we're trying to offer it more often, those types of strategies.
Thanks, Jen. So going back to the DCP testing, Rachel is suggesting a week and a half would provide a nice gap. And we're going to look into that spacing. Thank you, Rachel. Nancy is asking, is this for all 3 homes? I'm not sure if that was a reference to something else we were speaking of.
Sure. If it was the DCP testing, Grey Gables was the pilot and launched the opportunity this week. And the Manor is working out the details, and an email will come out soon. We are sending them only to the DCPs. We're not sending that email out to the newsletter email list. So if you are a DCP, you can watch for an email from the Manor. And at Rockwood, we're working out the details, and so watch for more information.
Thank you. private caregivers allowed in our homes yet, such as physio or foot care?
Yes. So I need to remember, because it's a little bit different at each of the homes. I believe that Grey Gables and Lee Manor have foot care contractors back in, and Rockwood does have foot care being provided through their staffing, and our oh, Terry just messaged.
I was waiting for your phone to go.
So the registered staff are providing the foot care at Rockwood Terrace, and Grey Gables does have their foot care contractor back, and Lee Manor does as well, I think. And yes, so it is just a little bit different depending on the circumstances around the contractor and their ability to be back at work, but we do have foot care being looked after by someone who is trained to do so. So whether it's the contractor or a registered staff.
Okay, that is good. All right, Donnie supports a non-risky Thanksgiving for all, and I think that's some advice we're all going to have to be taking inside of long-term care and outside of it. I have kiboshed my family Thanksgiving already, which my parents are not too happy about, but we will do what needs to be done this year.
I do wonder at the number of homes that I heard today suspending day trips and outings effective today. So I heard of 3 in Gray and Bruce today. So I feel like that's telling us that there is something coming. So we aren't quite doing that yet. We are just adding this other layer of protocol with this declaration. But and I will commit to sending out an email, a newsletter style email by Friday, letting you know if there's any further changes to the day trips and outings.
Thank you. So with such a focus on risk, are staff that work 2 jobs required to be tested every 2 weeks, Jen?
So we strongly recommend that all staff be tested every 2 weeks, and the numbers of staff being tested are increasing every time we do a surveillance, offer the surveillance dates. So we aren't, at this point, have not been able, with the way the policy is written, to require and make it mandatory that they be tested. And there is differing schools of thought around testing of asymptomatic people. And so it's like the flu vaccine. The flu vaccine is not mandatory, but we strongly recommend it. And we do a lot of education and a lot of discussions about flu vaccine and immunization. So it's very similar to that. But people do their own research and are still able to make their own choices around flu vaccine and COVID testing when they do not have symptoms. If anyone has symptoms, resident or staff, we automatically offer we do the COVID test, and we do them on site. The staff members are able to have that test at that moment. So if someone partway through their shift says, I'm not feeling very well, or when they arrive, they have a temperature, we do the COVID swab right then and there.
Thanks, Jen. And for those on the call who are interested in getting tests for visits and that sort of thing, I would remind you that locally our testing centers in Grey County have moved to an appointment-based model, so it's a little bit different than before. So I did just want to pass that along so you don't show up and be disappointed. Okay, Heather has a family member who's been on our wait list for some time. Can she remain hopeful about the placement despite all that's happening health-wise right now? Are we still taking people, are we taking people in off our community wait list?
Interestingly, I just asked one of the leaders a question about this last week, because I have an elderly friend who is in a similar situation, her spouse needs long-term care, and they live in the community. So yes, we are still admitting and moving in residents from both the hospital as well as community. And I believe that is also the case at Lee Manor, with the exception of 3rd floor south that has a respiratory outbreak.
Nancy asks if we've considered hiring additional hairdressers to help with haircuts at Lee Manor.
We are recruiting a hairdresser at Rockwood Terrace, so that's actively happening. To recruit additional, no, but that's a good idea. Thank you for bringing that forward.
And are hairstylists back at Lee Manor at this point?
At Lee Manor, I think yes. I'm going to just see what Stacy will send me a quick message. Yes.
Yes.
It's starting to get hard for me to keep track of all of the different the homes, and I was chatting with the EDs about, as we move through the pandemic, and let's say we keep our fingers crossed and things go very well, and wave 2 is really just a little bit of a wave and not a big wave, that we should look at opportunities to increase the panel and bring the EDs on to be able to help answer questions and get to connect with people.
I think that's a great idea.
Now though, they may all stop texting me now, we'll see.
Yeah. They probably just dropped off the call. Are there any plans in place for taking outdoor visits indoors for cold weather?
Right, thank you for asking that question. Lots of discussion about what does an outdoor visit look like in, I don't know, well today, right now it's pouring rain. What does it look like in end of October, mid-November, and even worse, what does it look like in February? So we have looked at different options, different outdoor kind of modular type item buildings and that kind of thing. I think what makes most sense is for us to designate a space in a common area inside the doors, not too far, that we will design under the protocols of the day. So whatever that might look like come October, November, so that we can set up a safe visit, an outdoor-like visit inside. So whether that means we have to have barriers in between the resident, like a plastic barrier in between the resident and the visitor, I hope not, but we are looking at what the options are if we're required to do that, those kinds of things. Dedicating a space, so we're take over a room and make it something different, a living room, or at Grey Gables, the chapel maybe temporarily, those types of spaces.
That's a good idea. Ian is wondering, are staff allowed to refuse a test once they come on site? We probably touched on this with tests not being mandatory.
If they have symptoms. I'm wondering if that has to do with having.
Maybe so. Yeah.
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 So they could refuse to have the test done by our staff on site, but we are required to contact public health, regardless of whether they've had the test or not, and let them know that we've had an individual not pass the screening, and send them off to an assessment center. It is much more convenient to have the test on site, and we haven't run into that at all. Staff with symptoms are very compliant and willing to get the test. No real issues there. And when we did the universal swabbing that was required by public health, we were 100% compliant. Everybody did the swab. And I know that if we were in a position where we had a positive COVID case at one of the homes, my understanding is that public health will think about whether or not everyone should be tested. And I have no worries that if everyone was required to be tested, that they would do the testing.
Are the staff and residents at Lee Manor staying on their own floor in light of the outbreak on 3rd floor to prevent spreading to the other floors?
Yes, so they are working, they are reducing the activities to smaller groups, neighborhood areas, so in the home area, limiting people from going kind of around the home where they can. And it will be newly signed tomorrow. So if you're a DCP and have had the ability to go out for a stroll in the courtyard with your loved one, the signage is going to ask that you go and have your visit and provide your care partner role in the residence room. So we're trying to limit the movement, trying to keep that contained and limit the spread.
Great. Are you still there, Jen? We've maybe lost Jen here. I'll just give her a moment and see if she can reconnect. Hopefully I am not the issue as the host on this end. Send her a message here. Conveniently, that did get us to the end of our Q&A that was showing in here. So while we wait to see if Jen reconnects, could be some internet issues on her end, but I will just remind everyone that if we didn't get to your question, if you've thought of anything else, or if something comes to you after the call here, you can always reply to one of the newsletters that we send out to your emails, or you can create a new email and send it to communications@gray.ca. And that will come to myself, and I'll make sure that if I can't get an answer to you, that I forward it on to Jennifer, and she or someone on her team will be able to get that back to you as soon as we can. As well, just a reminder, after the call tonight, we will be uploading this recording to YouTube. I'll send a follow-up email with some of the things that we talked about today, which you should get tomorrow. It'll have a link to this video. And if there is anyone that you know that might be interested in seeing the video, for sure, please do share it with them. It is open and public. And I see that we have Jen on her phone now.
Hello.
I don't see any more questions coming in here, Jen. So was there anything else that you would like to add before we wrap it up tonight?
Sure. Sorry about that. I think our internet just went down. So I did just want to mention to everyone that as a designated care partner, you are a part of our care team, just like our staff and our other stakeholders and caregivers that come in and provide support. So we need to apply the protocols around cohorting and limiting movement from one home area to another to you as well. And for the most part, that is being supported. And
Looks like she's gone again. Well, that is an unfortunate way to end things tonight, everybody. But I guess after the rocky start that we had with the email addresses, we will maybe wrap it up there. Thank you, everybody, for tuning in. We really do appreciate that you come on and listen. That tells us that you are getting value out of this, so we're certainly going to continue. I will check in with Jennifer and we will send that follow-up email out tomorrow, and we will maybe see about when we want to schedule our next call after we talk. And I think that will wrap it up for us tonight. So thank you very much for listening. Have a great evening and be safe. Thank you.